of the pay scale.
Shadrack, please hold on. The 10 years, is it from your home country or from Ireland?
Yes, well, in your entire nursing career.
Oh, that.
Yes.
So when you step into Ireland today, and you stepped into Ireland with 15 years experience from Africa, that is how they are going to scale your salary. Okay, yes. So, Shadrack, thank you so much for all the detailed information that you've given to us so far. But the next question that I want you to talk about to my viewers is the benefits of working as a skilled worker in Ireland, career advancements, Ireland cost of living, anything that you want to talk to us about, how working in Ireland benefits you as a health worker. Yes.
Okay, thank you. I mean, I wouldn't say I've regretted for coming to Ireland. I've never regretted. And first of all, I will start with the salary, the pay.
Okay.
That's what most people would like to consider.
Yes.
First.
It's very, very important. Money is blood.
Yes. So when it comes to the salary structure here in Ireland, if we are working for the government, that is, if we are working in HSE run facility, your pay is determined by your number of years that you have served, or in other words, your experience. Okay. Your experience determines your pay. So if, for example, you have worked for, let's say, 10 years, you're going to be placed on 0.10 of the pay scale.
Shadrack, please hold on. The 10 years, is it from your home country or from Ireland?
Yes, well, in your entire nursing career.
Oh my God.
Yes. So
including if you are
the number of years that you served in your country.
So they consider all that.
Yes.
So when you step into Ireland today, and you step into Ireland with 15 years experience from Africa, that is how they are going to scale your salary.
Yes.
Wow. It's not like that in the UK. The UK, it doesn't matter whether you are a chief nursing officer or you were Ghana's best, whatever, 50 years experience. You start from band 5. That is where you start from. Wow.
Yeah. No.
This is
Ireland, it doesn't work like that. So your experience will determine where they should place you.
These are my eyes are coming out.
That is something that is great. To me, it is great because, I mean, to have worked in your country for, let's say, 5 years, and then you go somewhere and they put you at 0.1.
Yeah.
And in the beginning, to me, it's not fair.
It's not fair at all.
But that is something that I consider very interesting here about healthcare in Ireland. HSE has done very well to implement such policy. Yeah. So the number of years that you've worked will determine your pay. And I mean, if you consider for psychiatric nurses, I think according to this year's pay scale for 2021, that is, so 2022, 2023, it hasn't come out yet. So I will quote only the 2021. Okay. So pay scale. So if a mental health nurse, and you are from the first entry level, which is you just graduated from college, and then so that one is starting from 31,795 euros per annum. That is the basic. That's the basic. Nice. It doesn't include the allowances and the overtime and all that. It doesn't include that.
It's higher than UK per annum.
So that is where the psychiatric nurses are starting from. So for general nurses, it is starting from just hold on, 31,109. So
it's all around the 30s.
Yes, it's all around 30. So you go on from there. So depending on your
please check for midwives for me. Check for midwives for me.
So sorry, for midwives, let me see the midwives. For midwives, just hold on 1 second. Okay, midwifery.
I'm eager to hear.
Yes, midwife to 31,109 as the starting point.
Wow.
Yes.
Ireland, that's
the entry
higher than UK, that point.
Yeah. So but if you are working in the private hospitals, it is much higher than the government hospital, yes, or the HSE run facilities. Then the salary to the HSE has introduced what you call advanced nurse practitioner positions. So what it means is that it's just an enhanced position. Okay, so if you have worked for it's 4 years, 4 years and over, if in your entire nursing career you have worked
also from your Africa, wherever you're coming from.
Yes, including your service in your home country. So even if you have worked in Ghana for, let's say, 4 years, when you come, you qualify to apply. Okay, so if you have that experience, you can apply, and it comes with enhanced pay.
This is beautiful.
Yes, so you get upgraded to higher pay scale.
Oh my
okay.
God.
And so when they upgrade you, when you apply, I mean, there are certain requirements. I mean, there are certain mandatory courses you are supposed to do, and those ones you find them in the HSC lands.
Okay.
And they are part of those compulsory courses that you'll be required to do even before you start work.
Okay.
So definitely you're going to have the requirement. And so when you apply and it is approved, you're going to get arrears for that.
Ooh.
You're going to get arrears. So if, let's say,
in fact, you are whetting my appetite for Ireland, though.
If, for example, you came 1 year later and then you apply for that position, you're not going to sign a new contract. It's going to start, it's just like a continuation of the contract. So you're going to get arrears from the first day that you started working.
Oh my God. That's a lot. So, Shadrack, are you working as an advanced, next position?
It's just an enhanced nurse position, all right? So it's just the same nursing responsibilities, but just enhanced pay. It's a system they introduced just to enhance
to encourage you, yeah. So you've applied for it and you've gotten such?
No, for me, I've not applied yet.
Oh, okay. I thought you
had. I'm thinking of applying it.
Please do. Let's get the arrears. Let's get more arrears. The 2 years arrears. Yeah. It's very necessary.
Yeah. Okay. So that is about the salary, and okay, the salary, the payment timelines too. Here we get paid every 2 weeks. Every 2 weeks, getting your paycheck. Yes.
Wow.
So that is something that I find it really great, because if you are waiting for 30 days before you get paid, I mean,
by the time the 20th day comes, everything, you are dry.
Yes, so in 2 weeks, whatever work you've done, you are going to get paid. And then the working time we are currently, when I came, we were working 39 hours per week, but it has now been reduced from July this year. It was changed to 37.5 hours per week.
So it has become just like
working for basically three days duty. The rest, you can use that for your overtime and all that.
Whatever you want to do.
And then whatever you want to do, if you want to go out to tour, or you want to tour the country, or whatever you want to do, this is your off day. So you can choose to do whatever you want to do your off days.
But then 12 hourly shifts, day and night.
Yes,
it's not like Ghana that you do 6 hours and so it's 12 hours.
Yes,
okay.
Yeah, it's 12 hourly.
Okay.
It's 12 hourly.
That's great.
So even at my workplace, we are running, if we are doing nights, you are doing 7 days night duty, then you have 7 days off.
Hey, 7 days night, it's serious. So I don't think I can do it. It's a
7 days night and then 7 days off. So of 7 days off duty. So to me, it's okay, because I'm running ministry, and if to get 7 days of my ministry activities, it's beneficial to me. Yeah. And in addition to that, let me talk about other benefits. So when you come in, I mean, the HSC has what we call a cycle to work scheme, where you can get a bicycle on loan without interest.
Wow.
So yes, so basically you will be required to just go to a company who sells bicycles. Then you get that. Then the employer is going to pay for it. You pay within 1 year, but without interest. You're going to pay it. All right.
Africa,
so
listen, Africa, when you go for a loan, they will drain all your blood. They will drain the blood from your salary. Listen, go to Ireland. You get loan for free, no interest.
So you get they are encouraging more people to cycle. So to park your cars and then cycle. So it's one of the incentives they have introduced to, encourage more people to cycle, to work.
That's nice.
All right. Yeah. And then HSE also has an office where, as a staff, if you have any psychological problem or personal problems that's affecting you and your job or even personally, they have psychologists and counselors there who you can access their service free of charge.
Wow.
They will help you in that situation.
That's nice.
And then the HSE also has anti-bully policy. Anti-bully policy. So if somebody is maybe, in this modern world, racism and bullying at workplace, when you bully a staff at work, or for example, you're a senior staff and you bully a staff, or even a junior staff, you bully other staff, and you are, and it is reported and it's investigated and you realize that you are at fault, you'll be punished.
That's awesome. So it gives the staff some kind of security.
Yes. Yeah. So there's anti-bully policy in this country. Yeah. And that is something good, what to promote, good working relationship with everybody. Yeah, exactly. Because ultimately, you're looking at providing, excellence service to the people. So, bullying is something that nobody is going to, promote that. So, and it is something in the modern world, in the Western countries, that everybody has to make sure that such practices are curtailed. It's not right. Okay. So let's move away from the hospital and then I'll come to the country itself. It is generally a peaceful country. It's generally a peaceful country. There are so many churches. If you're a Christian, if you're a Muslim, whatever being your religious background, you'll find especially when you come to even Dublin, it is a multicultural city. You find people from different cities.
You've whet my appetite. I'll come to Ireland very soon. Just for
when you come to Dublin and other cities, you have so many people from different backgrounds, different nations. And you find different foods, intercontinental foods, different foods, and Chinese foods, American foods, African foods, different kinds of foods. And you're not going to be homesick. Okay.
I'm on my way to Ireland.
And so you get your home food to buy.
That's
and
great.
So there are so many tourist facilities here. The biggest park in Europe is in Dublin, the Phoenix Park.
Wow.
Yes, the Phoenix Park. You go, you see the elephants, wild animals, the antelopes, beautiful parks. It's a beautiful place, and I do visit the place. So there's different places you can tour. They have rich culture. It's in great history. So it's a nice place to live. Yeah, it's a nice place. The people are generally friendly. Yeah, generally friendly. Though you find few people who could pass racial comments. And if I'm black, I know I'm black. So when you tell me I'm black,
that is I am black.
You have said nothing.
It's true, I'm black. So what is your problem?
You will find some few people who will pass racial comments, and I think it's because of, I think that the rationale or the cause is because of ignorance. Okay. And usually you find those who have traveled to other countries, who have ever lived in other countries, they're never racist.
Yeah, because they've also been foreigners before.
He has also been a traveler before.
Yes.
Okay, so I'm not much concerned about you being racist or whatever.
Yeah. Seriously, it doesn't bother me.
It doesn't bother me at all.
I know the reason why I'm here, so I'm just...
Yes.
Yeah.
So if you are coming here, you should sack yourself against racism. But the government too has anti-racism policy.
Okay.
If you are racist at somebody and it's reported, it's investigated, and you realize that, look, you demonstrated racism against a colleague or somebody, you'll be punished.
That's great. That's great.
Yes. So
the laws are in place to curtail, like to bring it down. Yeah.
Yes. So basically
talk about career advancements.
So when it comes to career,
it's very difficult for you to get educational leave, whatever we call it. You work for 10 years, 12 years, and you are still at the diploma degree level. How is it like in Ireland? Is it easy for you to get to go to school?
Yes, in Ireland you can go to school. There are so many courses that you can read, but whatever course you want to read, you have to discuss with the employer
Okay.
So they also tell you, also make suggestions as which courses can also help the service.
Benefit them.
So, but when you want to go to school, there's the application form that you have to complete and put in. You give to your employer. Your HR will work on that. There's a unit in most HSC facilities to work on that. So when your application is approved, they're going to pay your school fees. Then you work and then you school at the same time. So they're going to draw much flexible timetable work. Yeah.
And they will sponsor your school fees as well.
Yeah, they'll pay.
100%.
Yes, 100%. It will be paid.
Wow.
Yeah. So I mean, you have much flexible working time. You have most hospitals have what we call self-rostering policies that you decide to work when you want, the days that you want to work, you decide when you want to work. So you put in your request on, and then you get, yes. So whilst you work at the same time, you can school. Why not? So but HSC is sponsoring education up to master's level. You're not sponsoring PhD.
Okay.
For PhD, you can get your own sponsorship, but they can sponsor you up to master's level.
Lovely.
You can pay your school fees, provided when you complete school, you work with them for some time before, if you want to change employer, yes. So for career advancement, you can. And if also as part of your enhancement in your career, there are a lot of workshops that your employer will also organize for you. So, and you will be paid. When you attend such workshops, you will be paid, yes. And you can also apply for nurse manager positions. Okay, they also come with their own requirements.
That's after you've had the advanced, courses.
For that, what I think initially I was talking about the enhanced nurse position.
Yeah.
Whether you're an enhanced nurse or you are even a junior nurse and you feel you meet the requirement for nurse manager positions, you can apply.
Wow. And
yes, when you attend interview and you pass, if you pass, you'll be a nurse manager. Wow. So yes, so you can be a clinical nurse manager. Okay. So you can also choose to be a staff nurse, but a staff nurse too has also its own skills within staff nurse position. Okay, that's what we call even senior staff nurse. You
just
can
like
apply for a senior staff nurse. Okay. But to be a senior staff nurse in Ireland, you must have worked for, I think, 17 years to become a senior staff nurse.
17 good years.
17 years to become a senior staff nurse, including the number of services that your number of years you worked in your country. So if you work for Ghana for 10 years and you come to Ireland, you want to be a senior staff nurse, you have to work for 7 more years before you become a senior staff nurse. Okay. Or if you don't want to be a senior staff nurse, then you can go to school, get the degrees and all that, and then apply to be a nurse manager. Okay.
But Rashad, yes. Taking you back to the career advancements, you were talking about. I'm talking about education-wise. When you get into Ireland, how many months or years do you have to work before you can be given the opportunity to go to school?
In the first year is you are on probation.
Okay. The first 12 months.
Okay. Yes, first 12 months you're on probation. So after your probation, you qualify to apply to go to school.
Okay, that's nice.
After probation, yeah. And
reasonable.
You can, yeah, why not? If you want to read medicine or whichever course you want to do, it's all about, discussing it with your employer. Okay. If it's going to benefit the service, why not? Yeah. You get the sponsorship, and then you are going to pay for your fees and all that, and you are going to school.
That's nice.
So, yeah.
That's nice. So, Shadrack, how will you, I know that you've been in Ireland for about 2 years now, but then you still have, information about UK. Comparing Ireland to UK, what can you say? The advantages, disadvantages, what can you say shortly?
Well, I'll start from Ireland before I move to the UK. Okay. Now, in Ireland, one major benefit is that you have free water.
Wow.
You don't pay for water.
Wow.
So the only thing you pay is your electricity bill, your gas bills and all that, your utility, but water is free.
That's nice.
Yes, water is free. And then when it comes to your salary scale when it comes to the salary scale as a nurse, you realize that if you have worked for many years, if you have many years of experience in your home country, like for example, you are in Ghana, you've worked for 12 years, and now you come to Ireland, you place at the 12 points of the pay scale.
That one,
instead of compared to you where you have to start from band 5.
Yes,
I think you even start from
band 5.
I think you even start from band 3 before you write to the OSCE.
Yeah.
Then when you pass the OSCE, you are moved to band 5.
Yeah, I started from band 3 myself.
Yes.
Yeah.
Excuse me. Yeah. So in terms of that is quite okay, because one reason why some people to come to Ireland, and especially those with many years of experience, they remain, is that, for example, you have worked for 15 years and you are going to UK and you go to band 5. I mean, your salary is going to reduce drastically.
Drastically. Big time.
Going to reduce drastically. So it's quite better.
Yeah.
And then when it comes to childcare for those who have children, the government is also supporting the children with some amount of money every month.
Whether you are in the diaspora, whether you are a citizen or not, you get the benefits.
Yes, so that is for those who are citizens. Okay. For those who are citizens, but to become a citizen here, you must have worked here for 5 years to qualify to become a citizen. Okay. Yeah. But even that, I think even those who are still not citizens, there are certain support that they also get for their kids.
Okay.
Yeah. There are certain supports that financially that they get for their kids. So it doesn't only apply to only those who are citizens.
Okay.
Yes. What is most important is you are a skilled worker. If you are a skilled worker, you have a lot of benefits.
Okay.
Okay.
So
and then with the UK too, one benefit that is very great is that when it comes to accommodation, generally, especially from the Midlands or from mid section of England to the north, Wales, Scotland, and then from the mid section, like from Manchester, Nottingham to the north. I mean, accommodation is generally low compared to London and then Dublin. I mean, cost of living in cost of accommodation, in particular in Dublin, is really expensive.
Yeah,
it's very expensive.
Place,
but yes, for every capital city is expensive area.
Yeah.
So when you compare accommodation, I would say that cost of accommodation in UK is generally lower than Ireland. Yes. And I mean, UK is a huge country. It has a robust economy compared to Ireland, which Ghana, my home country, is even bigger than Ireland.
Yeah.
So in terms of the economy, UK has much robust economy. In terms of opportunities for education, UK offer much better educational opportunities compared to Ireland. So and I think it's because of the nature of the economy. The economy is really robust. So I would say when it comes to the Ireland and UK, I think these are few benefits that you're never going to find. UK is never supporting parents with any amount of money to support their kids. No, it's never happening. Yeah. And then for UK too, there's another benefit, which is the the health insurance.
Yeah.
The health insurance, though you are paying for it, but I think it's okay. In Ireland, there's health insurance, but it is not compulsory for everybody. You can choose to enroll in health insurance. Okay, so we are not paying for health insurance. So when you are sick, you go to the hospital, you pay your own bills.
Wow.
Here in Ireland, yes, you pay your own bills. But in the UK, you have the health insurance. So because you are paying for it, you attend hospital. It is free.
Yeah.
Okay, that's something that is good. Yes, because you are going to hospital, you don't know when you fall sick, and when you are sick and then you go to hospital and they say, let's assume your bills are really huge and you can't pay. So just imagine. Yeah. But if you are paying like UK is doing, then anytime you fall sick, you're not praying that you should be sick, but anytime you fall sick, you are covered.
Yeah, so you run to
and
it helps to reduce the mortality rates everywhere. That is one thing that really fascinated me when I came here, because working in the maternity, the kind of things I experienced in my home country maternity, you can take care of the person, but the resources, the person is not producing it for you to use on him. But here, everything is readily available. Even if you need 10 units of blood, it is available. It is there. Everything is readily available, and it makes the work very smooth and easy for you to do. But Shadrack, thank you so much. At this juncture, I would want you to give my viewers your final words. What final words?
Well, I would say that, first of all, I know what I went through as regards IELTS. So if I've written the test several times and you are not passing, don't give up.
Thank you.
Don't give up.
For this.
I will say that you should seek an experienced person to help you when it comes to IELTS. Okay. That's something that I didn't do initially, so I had to write it several times. Get somebody to evaluate your work, so you avoid my mistakes. And then also, if you have written the test and you qualify to work in Ireland, why not come to Ireland? Even if it is UK or America or wherever you want to work, you can go there later. Okay. So the pay is not that bad when you come to this place. Okay. And I know every country have both advantages and disadvantages. Even your dream country, you don't expect to find everything to be rosy like you imagine. No. So, Ireland is an interesting place. It's a nice place to live. The people are generally friendly. They are generally friendly. So feel free to come to Ireland. I know the registration process, sometimes it can be slow as regards getting the permit and getting the other documents and all that. But here they follow bureaucracy a lot. So you should be patient with them. And I know when you are patient, you will definitely come to this place and to work. And when you come to, make sure that you give your best to the service. Great. So that is what I would say for now. So thanks very much, Josfyn, for giving me this opportunity to share this information with your viewers. Great. I'm grateful.
Oh, Shadrack, I should be thanking you for giving me this. I feel so privileged to have you here on my channel, seriously, sincerely, and honestly. So, guys, this is Shadrack. I'm going to leave his link in the description section below. Please, if you are going the Ireland way, go and worry him, okay? Nipa baby one is an African adage. It means that one person cannot do it all. So go to him for your IELTS. Our next video with Shadrack, our interview with him, is going to be on IELTS. He's going to tell us generally what IELTS is about, and then you can go to his channel and get the detailed lectures that you need. Shadrack, God bless you so much for coming. To my viewers, if today is your first time coming here, kindly hit on the subscription button. And don't forget to hit on the notification bell so that you don't miss any of my videos. This channel has so much for you. And for Josfyn, greatness, what I say is that the gospel must first be preached. Put God first, and he will make all your heart desires to come to pass. Until we meet again on another session with Josfyn Greatness, it's bye-bye.